Dr. Liu, let's talk about, a missing teeth. Lots of people out there, sometimes we patients, we run around with a couple, two, three, whatever, missing teeth, and, well, usually we have them missing in the back, because obviously when a front tooth is missing, we rather fast run to a dentist because it's ugly. But in the back, we don't seem to be caring so much. And frankly, it doesn't look like there's such a devastating effect. It doesn't look like much happens, So why spend $1,000, $2,000 or $3,000, whatever it might take to fix those things if apparently nobody sees it, one doesn't even feel it. And yet, dentists like you keep telling us that that's not good and we've got to replace those teeth. Can you shed some light on it? Why we as patients don't really find it all that devastating? We don't find much difference after a few weeks when we're used to it to have an empty tooth there. We don't really find that big of a difference anymore, and yet you dentists keep saying, no, that's not good. Well, where does this difference come in?
Well, you're totally right, Helmut, and you won't feel that you won't feel any problems with that space there, but there's things are working in your mouth that may cause you trouble in the years to come. Basically, teeth love to move, Helmut. They love to move towards space. Either the tooth behind that space, it'll start to lean forward and move forward, and the tooth opposing it on the top will start to come down through gravity. So what will happen is, in the future, if you decide to replace that space, it may be more difficult. And those teeth that are moving, it'll become more sensitive, it'll be harder to clean. So there's a lot of issues that are involved, maybe not in the present, but in years to come if you don't replace that missing space with some prosthesis.
What are some of those issues? What are some? Tell us exactly what some of those issues are.
One thing is you may have some bone loss in some areas there. For example, the tooth that's on top of it, gravity is going to pull that tooth down, so the tooth is going to look longer than it should. More of the tooth will be exposed. You'll be more sensitive. And then there's even a possibility, many years to come that tooth will be almost touching your gums on the bottom there. So there are cases where that happens. For the teeth behind it or in front of it, they tend to move towards a space. So what will happen is you'll notice that maybe your teeth start to have space between them, or they start to get a little more crowded because of this space. So there's a lot of issues involved.
I see. So basically, when the teeth are moving, and you said bone loss, isn't it true that when a person gets a bone loss, not only will he perhaps lose more other teeth, but doesn't he also kind of basically start looking ugly, like a dried out tomato, because the bone, starts looking like an old person, like the people who, our grandparents, there was no implants or whatever, they looked like that. Is that having anything to do with it?
Well, that's some of it too. Depending on how many teeth and how much space you have there, yes, your cheeks will be retracted in. But the biggest concern is the other teeth around that space. Like you said, you may have more difficulty time brushing it. You may have some bone loss because they're moving. So eventually, maybe those teeth will have to be, pulled out too, because they can't be restored, or they're not functional.
Right, and so when they're moving, do the hinges, I think they call that the TMG or whatever. Anyway, the hinges, where and does the whole thing move because if you have a fence and you get a few teeth moving the way you explained, or a few fence posts moving, everything doesn't fit. Or like I'm a mechanical machinery engineer, if you have like a few teeth on a cogwheel moving, the whole machine starts kind of like aching. If that happens in the mouth, is that again creating other problems? Like some people say that some doctors say that maybe headaches and neck pain and shoulder pain, tensions start happening because the jaws are not arranged correctly.
That's a possibility. It can be, because the teeth, the one in the back, this is the back tooth, it'll start leading this way, so you'll have a little more trouble cleaning the area right in this area, so it can lead to further what we call periodontal disease or bone loss. And if you're not cleaning very well or your hygiene is not very well, that can lead to some problems, possibly headache, some inflammation, some discomfort in the area, and also the teeth in the front will start to move back and you'll have more spaces towards the front. So that can also lead to further problems. So yes, it can lead to further problems,
such as headaches and muscle pains and well, because that's not a good thing. I mean, if you run around with a headache, you probably sleep less. You're less concentrated at work. I mean, we all have woken up with a stiff neck sometimes, and it's just not comfortable. And if some of that comes from that, because of missing teeth and it not being arranged, then that would be a real good reason to also, fix that, wouldn't it?
Oh, definitely. I mean, in the present, if you can do it during that time you're missing the teeth, it'll save you a lot of trouble and actually money in the future, because if you do want to fix it or replace the space, you may have to do further things, like you have to do braces, or you have to do more than one implant, or you have to actually pull out the tooth to make space. So you may think you're saving money or it's not bothering you in the short run, but in the long term it may be costing you more.
Oh, and in the meantime have discomfort such as headaches and things, and even create infection. And you have mentioned the video on how bad infections are. Well, thanks for your candidness and telling us the way it is, Dr. Lewis. Appreciate it, Dr. Liu. Bye-bye.
Thank you so much, Helmut.